Hello, I'm John Broom with the Dalhousie Medical Research Foundation. This is part of a series of updates on some of the research taking place at Dalhousie University as it relates to the COVID-19 pandemic. Today, we are pleased to welcome Dr. Lisa Barrett, an assistant professor in the Division of Infectious Diseases at Dalhousie University and a clinician scientist at the Nova Scotia Health Authority. Dr. Barrett, I understand you and your colleagues are preparing a research study to evaluate the effectiveness of medications for hospitalized COVID-19 patients in Nova Scotia. What can you tell us about this study, and what do you hope to achieve?
This study is going to do something very important in fighting COVID as a pandemic, both for Nova Scotians and for Canadians. We don't have effective therapy, and therefore we need to take the therapies that are being suggested and test them properly. And that's what we're going to do here in Nova Scotia. But importantly, we're going to do this very pragmatically, which gives people access to this treatment, not just in Halifax at our academic centers, but all across the province, and at the same time, investigate the underlying reasons why people get so sick from an immune system perspective with this disease.
You've been spending time during this crisis working in long-term care facilities. How does your research influence the provision of care for your patients, and how does your care for your patients influence your research?
As a physician and a clinical scientist, the joy of my world is that I get to go to the people who need it the most and attempt to come up with new knowledge through my research that helps them. In particular, at this point, working with colleagues Dr. Ken Rockwood, Sam Cyril, Melissa Andrew, Shelley McNeil, and others, we've been working at Northwood, where people have experienced a significant amount of both death and morbidity from this infection. And so we go there to try and figure out exactly what might predict who's going to get sick and how we can prevent that the next time this virus comes by. And so my research is my patients, and my patients are my research, which is very rewarding and important to me.
Our global situation is rapidly evolving when it comes to dealing with COVID-19. Given your experience and expertise, what is the number one thing you believe Maritimers can do to help flatten the curve?
Nova Scotians, Maritimers, and Atlantic Canadians have a long and strong history of coming together to support each other in times of duress, and that's been so clear over this COVID-19 pandemic. People have been very supportive of each other and followed public health directive. I think it is imperative that people continue to do that. Stay socially and physically distant as much as possible. Wash your hands and don't touch your face. I've said it once, I've said it 1,000 times. It's key. But honestly, the next thing that we can do as Maritimers, Nova Scotians, Atlantic Canadians is to contribute to understanding more about this infection, more about how we can prevent it through research efforts. And so if you're able, becoming a research participant in COVID-related research is incredibly important to moving us forward faster beyond this pandemic.
Thank you very much for joining us, Dr. Barrett. We really appreciate hearing from you and the important work you're doing.
Thank you so much for reaching out, and let us know if there's anything else we can do to provide more information and support for research and for COVID-related efforts around the province.
If you'd like to find out more about the COVID-19 research DMRF donors are helping to support, please visit dmrf.ca/coronavirus. And if you have any questions or concerns you'd like to share, or if you'd like to help with the research studies Dr. Barrett referenced, we'd love to hear from you at dmrf@dal.ca. Thanks for watching.